thank you guys for joining the last presentation of the day. Hopefully you guys can join the last closing session coming up, but hopefully you've learned a lot from the other sessions. Today I'm going to be talking a little bit about a customer story, our story here at Children's Hospital Colorado, about how we use the different Hyperion tools to help support our business, especially in the challenging times that we're under, certainly with COVID. And give you some examples. I'd like to demo for you a little bit too as we go through this. So hopefully you'll get some tips and tricks and learn some new things that you can apply pretty quickly at your particular organization. So I'm going to try to start my slide presentation and see if it doesn't disappear from the screen, but let me see how that is. Probably looks like, does it show on my notes there, Tammy? Or
we're seeing the screen that has the controls.
It has the controls on it. All right. I'll tell you what, I'm going to, I'm not sure why it's doing that. Let me try it again and see if I can share over to the other screen. So let me just try this, and then I'll stop sharing momentarily and then go over to here. How about that? Is that better?
Yes.
Excellent. All right, thank you guys. So I'm going to be talking a little bit about us first, and then we'll have a few survey questions sprinkled in to keep you guys engaged. But please type in your questions as we go through it. We'll have plenty of time at the end to ask questions. Definitely want to dialogue about what you guys are doing, what's working, what's not working, and just talk about next steps. So really quick, we're going to talk about 3 different areas. So we do use the EPM cloud solution, so EPBCS for forecasting on the cloud. It helps us tell us where we're going, which obviously is challenging in these times when we had such a change in volumes in the March timeframe, April timeframe, and have since come back a little bit in terms of our overall volumes. And we are in the midst of a forecast right now for next year. So in real time, we're presenting to our executive team on Monday our forecast for next year. So at least top level stats as we build out. But we are doing this at a very quick, rapid pace, and love to share with you some of those ideas about how we approach forecasting and what we used to call budgeting, but we don't use that term anymore. Essbase cubes on the fly. We'll kind of talk about how we had to leverage Essbase in pretty rapid order. As COVID hit, we needed some new cuts of data, some new analytics. We had to change some applications around, but then also serve up the data very, very quickly. So I'll show you some of those tips in terms of how we used Essbase cubes kind of on the fly to just build cubes very, very rapidly. And then we'll end the discussion with some data visualization, how we're leveraging a little bit of DV today and proof of concept. And I got a tip even in one of the earlier presentations this week about how we can use narrative reporting. So we'll kind of demonstrate that feature to you guys here as well. A little bit about us. So we are Children's Hospital Colorado, largest children's hospital really in the 7-state region that we've got up here coming up, but we have 564 licensed beds, employees approaching 8,000. So this is from 2019. So fairly large, very important in the 7-state region in the middle of the United States. We do pull patients from all over, all 50 states as well as internationally to gain services, high quality care. This is a quick zoom in on Denver. This is kind of where we are throughout the Denver area. Right here, there's a kind of the center of the balloon boy. That is where I am actually at right now. Okay, so quick story too, just introduction about myself. I've been using Essbase for probably now 21 years actually, since way back when, just after it came away from Arbor and went to Hyperion. So longtime user of Essbase, certainly have done planning in a variety of different ways. be it on premises, and then move to Oracle Planning in the Cloud here at Children's Hospital Colorado. So first survey question we're going to ask everyone is just want to get a sense of people on the call, what type of tool you're using. So if you want to put that up, that would be great. Let's see if we can share that. Okay. All right, so quick survey question. So which planning tool do you currently use? So Planning Cloud, ePPCS, different terms for it, but are you on the cloud or are you using on-premises planning, a different tool, or do you not have a planning tool currently? All right, do we get our votes in? Let me go ahead and take a look at our survey results. All right, excellent. Okay, so these concepts should be fairly familiar to you, but I'll show you kind of what we did on ours, and then obviously if you've got some other ideas or things that have worked well for you, we can certainly talk about it here at the end. All right, so Plan on the Cloud. You know, we moved to Plan on the Cloud very quickly when I started here, right really when ePPCS came out as a product. So we were looking at on-premises and the cloud option came about. So we decided it'd be a great opportunity for us to move and start fresh on the cloud and take advantage of all the support services and rapid patching feature functionality that gets delivered time and time again. It's worked out really well for us. We get those patches once a month and then bigger releases. So it really hasn't caused any disruption to our planning process. And there's probably a lot more that we have not tapped into. So we're just trying to keep up with all the rapid changes that are out there, but very feature rich. Here at Children's Hospital Colorado, we do use the concept of beyond budgeting. So we've removed the term budget from our forecasting and planning process, and we now just do a forecast really for the next 18 months. And so it's a rolling forecast. We do focus primarily on quarters, but we do have the opportunity to do it monthly. And as soon as COVID started, we really were asked and pushed pretty quickly to say, hey, how's March coming in? Can we do another forecast really quick just to get a sense of where we're at and what levers we might need to pull? So we do leverage a lot of drivers and a lot of statistical relationships to understand what growth is happening. We're a very seasonal organization, so we can see those patterns, those trends, and then look for opportunities within those trends and see where we can make adjustments to perform even better. So we typically run an unbiased forecast pretty quickly, and then we do have to tweak things, certainly as business needs change. We do have the ability to layer in initiatives through another project dimension, so we can kind of factor in a new location opening, something like that, and layer those those specific volumes and income statement items directly there within that initiative. But we do tend to focus more just on key targets, those key KPIs, keep an eye on how we're doing from a productivity perspective, and put our expenses in terms of volume so that it's less about getting a fixed amount of money that we have within a budget and more into something that's relative to the size of your unit, as well as then allowing for flexibility of resources as needs come up within the organization. So we do use beyond budgeting. Love to talk with you guys later or after even this discussion if you guys have questions about that. So our forecasting journey, way back when it would take many, many weeks to just do the labor around doing the forecast. It still takes a while, obviously, in terms of meeting with our partners out in different departments, gather the information, gather assumptions, things like that. But the actual assembling and putting the numbers together and tying it out and telling a cohesive story, that's down to really just a few days to do that type of work. Still a lot of analysis, but think of all the work it takes just to do the logistics, that's been cut out. So it's much more of a, let's understand the numbers, let's make adjustments as we need to, and really do the analytic work that we need to do around a forecast. So it's still a quarterly process, but we can go to monthly as needed, and we can refresh right after our 5th business day, which is typically when we finish our books, and then repopulate, make some adjustments, and reforecast as a possibility for the 7th business day. Again, a lot of automated drivers and capturing those real-time assumptions while we reforecast as you're even meeting with the stakeholders kind of live. It's kind of fun. Currently, we're just using the financials module. There's certainly in our roadmap to leverage more of the functionality out there, but right now this is certainly meeting our needs. Certainly could do more within capital, and even forecasting more of our balance sheet would be helpful. As we move forward, projects is certainly another capability, and workforce planning. Although our workforce, we do have some other solutions around productivity and how we forecast some of those labor components. So we're feeling pretty good in those areas, but we do have an income statement focus. And again, it's an 18-month rolling process. Once we do have that forecast and it's underway, we do actually synchronize into an what was an on-premise. See, I didn't update that piece of my slide. I apologize for that. We do update an OAC Essbase cube 3 times a day. So it's a little bit easier to report off that slimmed down, fewer dimensions Essbase cube. So that has worked well for us. Again, happy to share more insight on how we did that with you guys if needed. Step through a few of the screens that we've set up, and they're kind of blurred out and blocked out, but really we're looking at this month over month. We're looking at change rates. We can calculate change rate. You can override that rate in the next column over. It allows you to document why you made those changes, what those assumptions were. We do have the ability to pick primary stats that drive certain departments. There can be secondary stats as well. We can forecast all of that together and take a look at all of our stats and volumes that drive our revenues, and then work our way through revenue into net revenue and then into the expense items. Looking at labor in particular, when we get into expenses, you can review and adjust those average hourly rates by labor pool. It calculates obviously what's been our typical run rate, and then we can make some tweaks as needed within the tool. And then at the end, it comes together as a full P&L. You can look at it on a form, or we can then sweep that out into Essbase, and we do that again 3 times a day during forecasting cycles. We do have one custom dimension that we did layer in. We thought about leveraging the projects dimension, or projects module, but this was a little bit easier, and it was it fit the need that we had at the time, which is just to create one additional dimension for projects, and then we can layer those in and out. So we can have a switch set within a forecasting module that says include or exclude, and then it recalculates. So we can layer things in and get multiple scenarios and assumptions or versions of the forecast. And lastly, from a healthcare perspective, one of the fun things we did add was we did leverage one of the extra planning areas to go down to and do some physician planning. So we're doing visit modeling. We do many hundreds of thousands of provider visits in an ambulatory setting. And so understanding what capacity providers have to see even more patients, look at those opportunities, and then calculate what our projected volumes are within those settings. That certainly is one of our key doors into our hospitals through our ambulatory setting, through referrals. So making sure our access points are good and make sure we're available to see as many kids as we can. So that's helped tremendously to build kind of a sub forecasting process that's now pretty much complete in real time now, and that'll feed directly into our overall forecast. You know, predictive, we did leverage predictive a little bit to kind of test some of those assumptions, and you can use a variety of different tools. I have a question mark here because I'm still asking some of the experts, and if you guys have opinions or understandings of it. it's like, how do you get around looking back historically? We see that huge dip in March and April and know that's not a recurring event. What's interesting for us is, I mean, you could take it out and kind of call it an outlier event, but that actually fit right within our seasonal event where we typically have flu season ending in March, and we do see a decline in overall census volumes getting into April. So while it was a much steeper decline, we can't really just discard the fact that there was a decline because that was kind of part of our seasonal business. So we're still looking at that and really understanding, like, one, how do we get around that dip? And then two, if anybody has a magic crystal ball that would tell us how we're going to head into next year and what volumes are going to look like, I'd love to talk to them, because I think a lot of people are scratching their heads like, how will this look next year? So again, a variety of different scenarios. You can leverage Predictive to add maybe another insight, kind of get a range set up, and then pick what we think is the most likely scenario for volumes. All right, so that's our forecasting tool. I was going to get into Essbase cubes on the fly and how that helped within COVID, but we do have another quick survey question. Just want to get a sense of people who are using Essbase today. So if you could just take a look, I'm going to look over at my other screen. So which Essbase product do you use? Do you use Essbase in the cloud? Do you use on-premises Essbase, or do not use Essbase? Just so I can help tailor some of the content. If you could answer quickly, and then let's see how the votes tally up. All right. Survey's down. Let's take a look. Okay. So we got half and half, and one person who does not use Essbase, but hopefully this will introduce you a little bit to the concepts of Essbase and see what we think. But definitely moving from Essbase on-premise, which we had here, into the cloud was really pretty darn straightforward. Certainly moving some of the automated scripts, some of our Maxell and things like that, took a little bit of time, but definitely very doable, and very satisfied being up in the cloud and taking advantage of those services. So I'll skip over the what is Askbase. I think you guys probably have seen that from other slides, if you know what that is, but we have the web UI, and I can show a little bit of that to you guys today if you're not familiar with it. Just helps us control how to build cubes, the jobs, and functions out there. One tool we did leverage a lot of was the cube designer within SmartView. I'll show you that. It just helps us rapidly change dimensionality on a cube, kind of rapidly prototype new concepts, and I don't know, it just was remarkable to actually use that. We hadn't really leveraged it too much, but once we got into COVID, we decided, hey, let's just try this. And certainly we got a huge bang for our buck using that tool, because we could take an existing cube, add some more dimensionality to it, add some more members to it through this add-in, build new multiple different cubes, and quickly get some new insight. One thing I want to stress to everybody too is I know we tend to be more of a financials group. My team has the advantage of getting a little bit more into the operational side. So going upstream into some of the subledger subsystems that feed into financials. And one of the systems we do support is the Kronos system. So we do have a few examples here, but we did create in the past a Kronos cube, and we kind of had a couple different Kronos cubes. With COVID, one of the things we were pushed to do is kind of be able to take a look simultaneously at what has happened and where we're going to go. And within Kronos today, we do schedule probably 80% of our resources within Kronos, and it helped us look at what forecasted needs or any gaps for even the coming week, because we started to get down to day by day, week by week, what was our gaps and what were our needs for the organization for COVID-related jobs. So if we could think back to March, what happened for our organization was a lot of our services actually got shut down. So we were more allowing more capacity or getting ready for a capacity surge in March and April, but also helping to, I guess, be available for non-COVID patients if other hospitals saw the surge. So we were asked to reduce services tremendously down to just essential services. And what that did was we certainly had a lot of extra labor. So some of that labor helped, we could quickly redeploy that within Kronos into other jobs. We actually had 500 different, I guess, 500 FTEs worth of jobs that got created almost overnight. But we had about 2,000 jobs that were, in a sense, from a productivity perspective now, kind of sunset or not as needed or as active. So we had to quickly move a lot of people out of one area into another area. And we did that through Kronos, but leveraging a new Kronos cube allowed us to keep track of everything very, very quickly in terms of where people were, where they're going, what their home department was, where they were transferring to, as well as the particular job that they were assigned to or covering. So it's helped us capture a really good story, especially as we apply for credits and things like that. Supports kind of the work that we did provide to the community as well as our organization as we went through COVID. So you can see, like here on my screen, you've got a COVID alternative hierarchy here for COVID total jobs. So it allowed us to take apart and just keep everybody in their home department, but then also view them within a COVID job structure as they supported some of the response efforts that we had. So again, super easy to kind of leverage Essbase in different ways than just financial ways. So Kronos is one of those. Peri-op space, or basically our operating rooms, is another area that we've leveraged Essbase for. So kind of helps us get more insight into types of cases that are going on within our OR suites and helps us plan again into the future. So all this helps track at a very detailed, granular level our actuals, and it all gets leveraged into our forecasting process as well. Really quick, this is a quick sample of what it looks like when you use the Cube Designer, the Cube Planner. So it comes out in a really easy to use Excel format. They did a great job building this. All you really need to do, and in red you can see the Kronos. If you want to create a different cube, you could just basically change the name to something that's not currently be used. Click the Create Cube button and it would pull all the different sheets together into a cube in the cloud. So super fast way to deploy. And in the past, you'd have to create a lot of load rules and build dimensionality, very, very tedious to kind of get everything up and running. And this kind of helps automate that. So hopefully it gives you a good flavor of how we used it. I can demo if we have time in a little bit, but I did want to get into Oracle Analytics a little bit, and we are just putting our kind of our toe in the water on the data visualization side. We do have some OBI executive dashboards that we've created and have gone very well. They moved up to the cloud very seamlessly with very little effort and very little tweaking. And data visualization is now the next place that we're going and leveraging that compared to some other products. So before we get into that content, I have another last survey question. So just curious, who's using Oracle Analytics data visualization tool? Do you currently have it or do you use it? So simple question for today. All right, we can take that down if you want and just let's get the results. So, okay. So I'll give you a quick insight. A couple people have it, a few people don't. I'll show you a little bit about how we use it. There are a lot of different tools out there. We certainly have different tools as well within our organization, not just Oracle Analytics. We do use Tableau and we do use Power BI as well. But Oracle Analytics is here, and we've been leveraging it for a few of our use cases, and I think there's a lot more we can leverage with it. So kind of two sides. It has the data visualization piece and then the dashboarding piece. Dashboarding, we've got a really good setup. DV, we've got a little bit of some use cases to go, but really cool to explore data rapidly. So what I've got up here on the screen is just a quick, somewhat changed data set, but it gives you an idea. You know, a quick question came up when we were trying to look for some of the levers to save money in the times of COVID. Was we were looking at historical utilizations of paid time off. And what we definitely noticed quickly was once the lockdowns hit, a lot of PTO was canceled. So it was traditionally of large time for PTO taking for spring breaks and things like that. That all got kind of taken away. So as we were looking for opportunities, you know, looking for levers to pull, encouraging people to take PTO as we got into May and June timeframes, take a break, take some PTO, and trying to catch up some of those PTO hours that weren't taken so that we could see some recovery there was very important to us. But we could see very quickly these peaks and valleys, and you know, the highest peaks there are right around the Christmas New Year's timeframe, and then you can quickly see shortly before that's Thanksgiving, and then the three kind of peaks that you see year over year is Memorial Day, 4th of July, and then Labor Day. So it's an interesting pattern, really quick. You just basically take your data. If you're using Essbase today, super easy because you can do your smart view pulls in Essbase, create a record set, import it, and do some quick visualizations on it. And then at the end, you can see it's doing a little bit of forecasting on that as well, which you can do very quickly as well with using the tool. Just a very rapid way to get some insight into some data sets. And I'll demo for you another quick example of that. Just a quick picture of our executive dashboard here. And this just shows some of the things we refresh on a daily and monthly basis. So in closing, we did use kind of three major components to help in our COVID response, and we continue to use them every day, getting more insight in other areas. Most recently working with our revenue cycle team on understanding some denial management with payers, as well as some reimbursement. If you're in the healthcare area, you know how important that is. So hopefully that has helped. Definitely want to kind of flip over, do a quick DV example if that'd be helpful for folks, and then we can open it up for questions. So I'm going to, in my slideshow, and let me see if I can reshare my screen. Hold, please. Okay. So hopefully you can see my slides, and I'm going to bring up data visualization. You see that out there? Is that good?
Yep, you're good.
Thank you. All right. So I'm just going to show you really quick. So this is what Oracle Analytics Essbase is. This is our production Essbase area. I got some great buttons going across. These are our different applications and cubes. We do create a bunch of different versions and different cubes if we're testing out different things. But super easy to create a quick export outline. So I'm just going to demo that for you really quick because I did this already for one. So I've got just phys data number 3 out here. I'm just going to export that to Excel. Click OK. It's going to run super quick. Create a file for me. I'm going to open that up over here. Hold please while I slide it over. Okay, here it is. What this basically is just a quick snapshot of the cube designer within SmartView. So it creates our file. So if you maybe want to add a dimension, you're like, I don't know if I feel comfortable about adding a tab. One tip I would offer to you guys is just add the dimension within OAC Essbase. no members, maybe add a couple of dummy members in there. Then when it exports, it'll actually have the format that you need. And then you can simply just add rows underneath it. And it's just that simple. It will suck it right back up into the cloud. So I'm going to go back here. And just for quick demo purposes, one thing, since I've downloaded this a few times, there are some spaces in my names, and I found there is an error when you do have spaces, believe it or not, in the name of your project. Actually, this one looks okay. So I'm going to go ahead and change the application to version number 4. Go back over here, go to my cube designer, and I'm just going to say build the cube. And I'm going to build a cube called phys my initials number 4. And it's going to say create a cube because there's no cube like it out there. Kick off the job. It's going to run for just a second. And then if you remember, there's no phys number 4 out here right now. If I go look at my jobs, I might be able to see it running right now, and you can see it's being built in the job console. So it's coming from me. Just started it. We're 13 seconds in. Coming up, and just, and it's done. So in 27 seconds, I've built a cube, and that cube is ready to go. So go back to my applications, scroll back down, go back to my phys data section, and you'll say like, hey, wait a minute, where'd it go? Let's do a quick refresh here. So I had it cached out there, and there's number 4, and it was live a few seconds ago. So just that fast, I've got a cube, I can smart view against it, load my data in, and away I go. So just wanted to show you how easy that is. I mean, in a matter of seconds, you can take data from that spreadsheet, cube builder, cube designer, and create a quick cube. Last thing I want to demo for you guys is just the visualization piece. So I mentioned, getting away from some of the financial data into some more operational data. So we're looking at some Kronos data that I've dummied up here just for example purposes. And one of the things we watch for, and this could be something your organization's interested in as well, is to kind of detect some outliers in activity. So transaction processing, or in this case, punches that are happening at a clock. So we do allow our employees to, if they're missing a particular punch because for whatever reason they hadn't clocked out for the day, we do allow them to fix that missed punch, enter it, and then it gets reviewed by their management. But sometimes you can see a pattern of maybe some people who fix their punch maybe more than others. So we created this quick plot here of missing punches, and you can kind of quickly see names as you hover over those particular boxes. If you use the narrate feature, and that'll come in, like you can just quickly add a box and then present this information very quickly to leaders to kind of show what's the trend and where things are clustering overall. One more cool thing I'll show you guys, I just learned about this week. So if you've got DV and you want to try it out, I highly recommend it. It's pretty darn cool. It's the coolest thing I've learned this week. So, and I think it's a new feature that just dropped in with this release, is this narrative language visualization, which I'm just going to drag it out here for demo purposes. So live demo of a data set. And it just says add your data here. I go back to my, oops, we're off the screen. Back to my data set, and I'm going to say I'm going to look at missed punches by department. So I'm going to drag department into the box, and I'm going to say look at my fixed missed punches value. And what it does is on the fly, it reads the data set and gives you a nice scripted readout. So a narrative around what that data set's saying. So it's kind of interesting because it says, this is the total departments that were out there. And then what stands out in the situation, a few departments account for more than half the total. And then it proceeds to go through what those departments are. So there's 35 departments up here that have a majority of those combined. There's another 415 departments that have the other half. So it does that quick analysis and tells a story very rapidly of a data set. And you could take any data set that you have, again, just in Excel. If you've got rows and columns, bring it up here, create a data set, and it'll read and detect some patterns. The other cool feature out here is if you've got a particular measure, you can click the explain button and it'll go through and it'll just quickly create some very rapid graphics of your data set. So you're not just building a bunch of graphs. It'll actually generate the graphs. You can just check the boxes for the ones you want, add selected, and you very quickly get to some insight. So this is what it looks like in the end. So you get your quick graphics, you can put that into a narrate and very quickly start to explain your numbers. For me, it's been a bit of a game changer because a lot of times if you're just in Excel, you're just trying to manually try to detect some patterns, clean some things up. In the prepare step, it'll actually recommend and add some additional enhancements to your data set. So you're not just doing a bunch of formulas in Excel to maybe break out months into quarters, into years, things like that. We're all very good at Excel, but this kind of recommends some preparation steps and creates some dimensionality very, very rapidly. So in a matter of minutes, you can get from kind of a raw data set into some visualizations and some hopefully actionable insights. So hopefully that has helped explain some of the features from a customer perspective. Love to hear some questions now as we have time. We've got about 8 minutes left. So I'm going to shrink my screen down. And what questions do we have? Anything in the queue right now?
No questions currently. Feel free to submit any questions if you have any. Or maybe you were just that thorough.
I don't think I was that thorough. But anything at all you guys want to share in terms of where you're at in your journey? Happy to hear from you and talk about it. My contact certainly is in it's either in the presentation or reach out to NRL. I think we're going to have some notes on how you guys can follow up with me if you guys have additional questions about how we've used the different tools. Love to talk with you guys, get some ideas from you guys, how you've been getting some insights from different data sets. So, all right. Any other questions? Anything pop in?
Not yet. We can give it a few minutes if you'd like.
Okay. All right. All right. Well, we'll go ahead and end there. If there's nothing coming in, it's totally fine. Give you guys back the gift of time, and you guys can get ready for the closing ceremony. Hopefully, you guys have had a great conference. Hopefully, you gained some new insight from this presentation. And again, happy to help. So
One
feel free
question
to reach out.
question did just come in. Would you be
Excellent.
considering leverage the free-form planning in the near future?
Yeah, definitely. I think so. Freeform planning. Are you thinking more from using that for the Essbase cube, or just kind of leveraging it to add more to the planning process? Because I think there's a lot of different capabilities using that freeform planning, and I think as our licensing will start to evolve in the coming years, because we're on ePPCS now, and we'll be moving probably to the new suite of products here once that contract period's up. So I think there's a lot of possibilities there with the freeform planning, and look forward to leveraging it. Absolutely. Well, thank you again for your time today. If it's okay, we'll go ahead and end there. And again, you've got my contact if you want to reach out afterwards. I'm happy to share any content. So enjoy the rest of your day. Thank you.